Hello, I'm Christine Rush, and I'm a student at Western Governors University in the RN to BSM program. And as part of my language and presentation, LUT, I chose to do a topic on the effectiveness of case management in reducing readmission rates. According to the CMS, the implications for poor case management will directly affect patients' outcomes, and insurance providers are withholding reimbursements for hospitals if the readmission occurs within 30 days. So this is a very detrimental effect on the viability of hospital institutions if they aren't able to get the readmission rates under control. So we can start with an example here. A patient comes into the hospital, an elderly woman with shortness of breath. She has some lower extremity edema. She was not taking her medications, has gained some weight over the past few days. She comes into the hospital and they decide to admit her with a diagnosis of CHF. This is where the case management now begins the proactive discharge planning process. Initially, by interviewing the patient, if the patient's clinically stable and she's able to do that, interview the patient or the family or caregiver. And if the family or caregiver isn't present with the patient, then they can do so by phone. Hopefully that's what they can do. Just to get some demographic information and find out, assess for any gaps in care, such as financial, if there's any financial gaps. Do they have access to healthcare providers? Do they have transportation access? And what is the patient's home environment like? What are they going to be going home to? Are they able to navigate their home if they have steps in their home? Can they get to the bathroom? Are they able to prepare meals? Do they live alone? Do they have someone that can help them? These are some of the things that the case manager would initially try to gather this sort of information. The next step would be team collaboration, and that's with the physicians and nurses, therapists, and attempt to get a good idea of what the clinical diagnosis is and the plan for discharge. So if the plan for discharge, say, is the patient's going to be going home, the case manager would then determine, would this patient be a good referral for home care? And she would then get in contact with the home care on the phone if a referral is made, and begin the process of setting that up with the insurance information and diagnoses and things like that. And again, to just continue going on with the discharge planning process, which includes discharge instructions for the patient and to review those with the patient. Does she have her medication prescriptions, know how to take them properly, what they're for, dietary restrictions and information, and any specific instructions that would be important for someone with CHF, such as taking their daily weights. Does she have a scale at home that she's able to do this? Does she know why she's doing it? Okay, and the next step would be getting ready for discharge, reviewing all these instructions with the patient, with the family, making sure that they understand they need to make follow-up with their doctors when they're discharged. And this can also be done while in the hospital. The case manager can reach out to the physician's offices and make follow-up appointments for the patient. Then, once the patient is discharged, they can see our nice little lady is here at home, and the home care nurse is with her, going over all her discharge instructions that the hospital staff went over with her to make sure she has an understanding. And ideally, the caregiver or family member would be there with her to assist her. And finally, she would be going to her doctor's appointment for follow-up and have a good understanding of her treatment plan, medications, and so forth. Okay, and some statistics here that I'd like to point out. In 2013, almost 18% of Medicare patients were readmitted to the hospital within 30 days. And according to the Centers of Medicare and Medicaid Services, approximately $26 billion are spent annually for those re-entering the healthcare system within 30 days of discharge. And of this amount, it is noted that 65% of these admissions were preventable if effective case management was implemented. So you can see how important it would be to have someone who is advocating in that way for the patient. According to the Agency for Healthcare Research and Quality study conducted by the U.S. Department of Health and Human Services, patients being discharged from the hospital who have a clear understanding of their hospital discharge instructions and how to take their medications and when to make follow-up appointments, they are 30% less likely to be readmitted to the hospital within the 30 days of discharge. So these are pretty significant statistics and very important for viability of hospital institutions. Yes, do you have any questions?
Yes, Chris. Tell me a little bit about the role of the case management. Exactly how does it work? Just elaborate a little more.
Sure. Well, once the patient's admitted to the hospital, the case manager, will immediately gather all the data and information that's needed and start to assess for any gaps in care. And then they would continue with the collaboration process with the healthcare team, getting the patient's diagnosis, what the discharge needs might be, whether it be home care or outpatient follow-up, and they can make the referrals to home care, make the phone calls themselves and set it up, and also set up hospital doctor appointments for the patients as well.
So it seems like case management really is the link through the whole process to make sure the patient gets the care that he or she needs.
Absolutely. It's extremely important because if patients come into the hospital and let's say, for example, this woman, if she wasn't taking her medications, it's important to find out why. Was it a financial reason? Was it a knowledge gap? Did she not think she had to take them, or didn't have the money for her medications? Did she not have access to going to get her medications? She has family and caregiver, but the case manager has to do a lot of investigation and make sure that they're communicating and they are a resource for the patient as well if needed.
Besides CHF, what other chronic disease do you see where patients are readmitted within 30 days?
COPD is another one.
Oh, okay. Why is this collaborative process so important to case management? I know you kind of answered that in the first question, but just again.
Right. And it's just stressing the importance of the collaboration has to be done. Everybody has to be on the same page as far as knowing what the patient's needs are. That would include not only their medical needs, but their psychosocial needs, financial needs, transportation needs, any of the gaps that they may have, and you collaborate with the rest of the staff in order to assess for those gaps and initiate all efforts to close them. Thank you very much.